hold while we connect you to the conference.
Hi, Dr. Noel. You're on a recorded line with MG Live. I'm board certified in internal medicine. I'm calling for Omar Mohsen Ibrahim Fuad.
Good morning, doctor. I feel nauseous, and I noticed there was blood in my stool. Did you receive the pictures that I sent?
Yeah, yes, I did. Is your date of birth 12/14/88?
Yes, ma'am.
Thank you for taking the time to give us feedback. Please use your telephone keypad to enter your responses to 4 questions. On a scale of 1 to 5, where 1 is poor and 5 is excellent, how would you rate your overall call experience today?
Let me call you back, okay?
Okay.
I don't know why this is happening.
I'm sorry, I didn't capture your response. On a scale of 1 to 5, where 1 is poor and 5 is excellent, how would you rate your overall call experience today? On a scale of 1...
MDL IV provider. Calling. Please hold while we connect you to the conference.
Hi, sorry about that. I don't know why that recording came up. So you've been having nausea for how long so far?
I've been feeling like this since yesterday. And I noticed when I was on the toilet, I felt like I was like literally about to pass out. And then I fell asleep. But then literally right before I was literally about to fall off the toilet, I woke up. So I don't know why that happened, but then I noticed when I used the bathroom today, there was blood in my stool.
Yeah, I see that. And you used the bathroom how long ago? How many hours ago?
I took that picture at approximately 12:09 a.m. And then I called at, I think, let me see. I took a screenshot of it.
Do you have stomach pain?
Not right now, no.
Any fevers?
Not really.
And you only had that bloody bowel movement just one time?
Yeah, I just noticed it right now.
You've never had this problem before, right?
I had blood in my stool, I think several months ago. But it wasn't like this. Like, it wasn't to where when I would sit on the toilet and I'd have a bowel movement and then I'd feel like I was about to fall asleep and then I'd actually fall asleep. And then literally right before I was about to fall off the toilet, I woke up. And then the next day, I noticed there was blood in my stool.
What other medical problems do you have, if any?
I don't know. I don't know, honestly, but I'm hoping that I wasn't, like, raped or something, or somebody snuck in my house and put, like,
What other medical problems do you have?
I don't know, but I hope somebody didn't break in my house and try to put, like, a date rape drug in my food or something, or rape me when I was sleeping.
Do you have any other, other than, so I'm just going to read what you said here. So medical problems, schizophrenia, a lot of injuries, pain, and back pain, neck pain, any other medical problems that you have?
The schizophrenia, what is schizophrenia?
I'm just reading what's in your chart because I'm asking you what medical problems you have and you're not really answering me.
Yeah, the injuries, the neck and back injuries, those are correct. Yeah, but I don't know what schizophrenia, what that is coming from.
That's what it says in your chart. What other medical problems do you have? I mean, what other medications are you taking? Any medications currently?
Just the pain medications that they prescribe me, muscle
Pain
relaxers.
Okay.
But I haven't taken them recently because I haven't been feeling good. And
Okay.
they make me feel sick.
Yeah, I'm gonna send you something for nausea. It sounds like you might have some sort of infection, maybe some sort of virus infection. I can't explain the bleeding though, because you shouldn't really have bleeding typically when you have like a stomach bug.
Yeah, and I don't have hemorrhoids either, so it's not like there's a, when somebody has hemorrhoids, it's kind of normal for them to see blood in their stool because they're like straining to poop or something. But I'm not straining to poop. It's coming out very smoothly, but there's blood in it.
Okay. And you have the allergies you have in the chart. I have is Ativan, Xanax, Haldol, ibuprofen, and Saffris.
Yes.
But it says you're taking ibuprofen, but you're allergic to it.
No, it's a specific brand of ibuprofen. It's called Reddy's ibuprofen. REDDYS. Reddy's ibuprofen. It's the ibuprofen that they give to people when they're at the Florida Department of Corrections.
Okay.
I noticed it made me sick, and I had from what it felt like, it was like a heart attack and a panic attack, and it made my earlobes swell up. I had an allergic reaction.
I'm going to send you a medicine called ondansetron for the nausea. And then if you have a primary care physician, you need to call them to give you a referral to see a gastroenterologist. They might have to do a scope to see where in your gut the bleeding is coming from and fix it from there. So you definitely need to do that. Now, if you notice that your bleeding still continues throughout today, you're going to have to go to the ER.
Yeah. The problem is when I go to the ER, they harass me a lot. And then they send me unsanitary transportation to drive me to the emergency room. And then they send me unsanitary transportation and bring me home from the emergency room. And the unsanitary vehicles, sometimes they'll be filthy. Sometimes they'll smell toxic and contagious. Sometimes they'll smell toxic, contagious, and the seats will be filthy. And I'd end up getting sick just from sitting in the vehicles. And I'd end up having to go back to the emergency room because I got sick in the vehicles. So it's like it causes me problem after problem. And my neck is always hurting. And it makes my neck hurt worse because I'm having to travel to and from so many times. And it's just, they're making more problems than they should. And they're doing it on purpose. It's just like it's as if they're purposely making me live just to suffer and bill my government health insurance for injuries that government employees caused me. The neck and the back injuries to my upper and lower extremities were caused by government employees in 4 different police brutality cases. And they've been trying to cover up those cases ever since I reported them. And they've been doing things like I just mentioned to you. And they've been doing that on purpose to try to make me give up on complaining and going to the doctor and, documenting, through medical professionals and participating agencies what they're doing to me. It's like they're trying to scare me out of complaining.
All right, I sent the prescription for the ondansetron. That's the nausea medicine. And then, like I said, I advise you to go to the ER if this bleeding continues. All right, sir. So that prescription, they should be able to fill it for you sometime this morning so you can get some fluids in so you can eat and drink fluids and keep yourself hydrated as much as possible.
Yes, ma'am.
Okay?
Yes, ma'am. And could you send the referral to my primary care physician?
What referral? I can't send referrals to your primary.
Could you recommend a referral to my primary?
No, you have to call your primary and ask for the referral. We don't send anything to your primary. But you'll have access to the documentation that I'm putting in the chart. So you can always download it and send it to them if you'd like. But we don't fax anything. The doctors, we don't fax anything to any office. You have access to your records 24/7. So you can print out everything I'm saying and doing for you to your primary.
Okay. All right. Thank you, ma'am.
All right. Take care. Bye.
Same to you. Bye. Time now is 5:33 a.m. Today is October 2nd, 2024. The duration of this audio transcript is 48 minutes and 24 seconds. Assalamu alaikum wa rahmatullahi wa barakatuh.